How we doing? How bad was that green shirt? Okay, here we go. Welcome to an edition for What It's Worth. I'm your host, Tommy Colletta. Tonight we're going to talk about your teeth. It's something probably you just take for granted. You think they're there, but we have probably the best dentist in the area, and he's won numerous awards with us, and we're going to talk about your teeth, and you're going to be amazed by some of the new things that have happened in the last 20 years. I know a lot of us, myself, were kind of ignorant. We think it's like the old days. Every 6 months you go in, you get a cleaning and you go home, but things have changed. Nutrition's come in, and we have, I told you, the top doctor, Dr. Stanley Levenson. Welcome to the show.
Thanks for having me tonight.
Things have just really changed, right, in the last 20 years of how you approach.
Yeah, absolutely. I've been in practice over 20 years now. It's hard to believe. I've known you for over 20. My perception when I was a kid and growing up in the 60s and 70s is, again, you go to the dentist every 6 months. You pray you don't get a cavity. If you do, they drill a big hole in your tooth, stuff some metal in there. They teach you to brush and floss, and that was sort of it. Obviously, as I became and entered the profession, I knew there was more to it. But what's going on in dentistry today is incredibly exciting, both from a health standpoint as well as an appearance standpoint. So there's a lot going on that we can talk about tonight.
Okay, Stan, let's start out again. Let's go back to that. I think a lot of people still feel this way. A lot of people are still afraid to go to the dentist. Is that still as large as I talk to a lot of people? They say they haven't been to the dentist in 10 or 15
You're
years.
absolutely right. One of the problems we see is there are people that are still afraid. In fact, Tom, actually only half the population goes to a dentist on a regular basis.
Really?
As I said, there's a couple reasons. One is fear, one is the cost, and one is time. You either don't have enough money, you don't have enough time, or you're afraid and you don't want to go regardless. We see that every week. I get a new patient that hasn't been in X years for a variety of reasons.
And, okay, is it like a car, the same thing, that if you don't go, your teeth are going to be a lot worse than if you stay on a regular basis, obviously?
Well, we'd like to say that, but it's not that simple. Sure, if you go to the dentist on a regular basis, the odds are the dentist, as well as what you do, is going to be able to ensure your teeth are going to stay healthier, and hopefully you keep your teeth for the rest of your life. But there are other components that we know about that are very important. There's a genetic component. I ask people very often that have bad gums, do your parents have their teeth? Did they lose their teeth? That's a factor. The health, how well their teeth were taken care of when they grew up. If you grew up with, having 20 fillings and 20 cavities, the odds are you're going to need more adult-type dentistry. A lot of younger people today fortunately haven't had to face some of the things that we faced as kids and people older than us have faced. So there are a lot of factors. Nutrition's a factor, genetics, how well you take care of your teeth. So we like to say that we try to customize, at least in our office, treatment as well as frequency for every individual patient. No two people are alike. Everybody really has sort of their own plan, and hopefully they're able to follow through with that and ensure that their teeth and mouth and as well as their entire body is healthy.
Okay, Stan, in the old days, I remember my grandparents and parents that people got false teeth, and they had all their teeth taken out. It seems like a lot of people in their 50s and 60s, 20 or 30, 40 years ago, that was it.
Yeah, I even know. I agree with you. I think that is changing. In fact, I can be pretty confident if I went back and looked at my records from 15 to 20 years ago, I was making more dentures than I am today. Today, when I make a denture, typically it's a replacement from a worn-out denture. The idea of removing teeth is a last resort. We try our best to help people save their teeth because we know, especially as we're an aging population and people live well into their 80s and 90s, I can tell you unequivocally, if you've worn dentures for 30, 40, 50 years, if you're blessed to live to that ripe old age, your teeth and your jaws aren't going to work as efficiently, and you could develop problems chewing, digestion. You clearly can see that in an aging population, people in their 80s and 90s, the people that do better and thrive are people that do have their teeth.
Well, let me ask you a question. Is it inevitable if you're going to live to be 95, you're going to lose your teeth? Or can you have basically your original teeth?
Yeah, not
you're
inevitable.
99?
In fact, Tom, I had a lady in today, 96 years old. She hasn't lost a tooth in 40 years.
Really?
She was so upset today because a bridge fell out.
Wow.
There's a very sharp, mentally 96-year-old who I can pretty much assure her she'll keep all her teeth whether she lives another day or 5 more years.
So then it really is not to try to push a business to get people in. It is worthwhile to go to the dentist. I think some people think, well, I don't want to go in there and spend the money because it's inevitable. You're probably going to lose your teeth when you're 80 anyway.
Well, that's not the only reason. Oral cancer is on the rise. We screen people for oral cancer twice a year. We have technology that makes picking out oral cancer sooner a reality. That's a good reason to go to the dentist. I think physicians are trying to work a little more cooperatively with dentists regarding other issues. For instance, we know through relatively new research that there is a definite linkage between heart disease and gum disease. So we see people before heart procedures that got to come in and get their clearance, make sure their gums are healthy because there's a risk involved. So there's a lot of things that are tying in together where we used to think the mouth is like here and the rest of the body's here. No. Dentists are simply not tooth mechanics. We're really physicians of the mouth. And your dentist should be thinking about all that as opposed to just worrying about filling a hole in your tooth.
Now, okay, what would you be advice to somebody? Somebody says, I haven't been to the dentist in 20 years. That must be common. Someone says, I haven't been to the dentist in 10 or 15 years.
I mean, I had a guy in today that was very nice gentleman, new patient, not a new patient. He hadn't seen me in 5 years, very apologetic. You know, life happens. And unfortunately, with your teeth, unless something bothers you, you can forget about it. So it's not too late. I have, during the course of a week, there's at least one person that hasn't been in for a while. And again, it's never too late. And frankly, if the longer you wait, the worse it is, typically, with more problems, more work. You know, I'd like to be of the mindset that, okay, you go to the dentist and every year maybe you have to have one tooth repaired or fixed or filled. I'd rather do that than after 10 years you got 12 teeth that need to be restored. That's where it becomes very discouraging. So when we get people like that in and we get them healthy and we get their teeth fixed and we get their gums healthy, we fix their smile, then they should be able to look forward to hopefully relatively good dental health with a minimum number of visits to keep them healthy.
All right, Stan, let's jump in. We were talking before the show, and he was talking about nutrition. And I think people think if you drank milk, that was it. You in the old days, you know what I'm talking about? You drank a lot of milk, you're going to have great teeth. Elaborate on what we were talking about, how nutrition plays a role.
Well, nutrition plays a role, I believe, in your dental health, or more so in the health of your gums. I know it's common knowledge, the word antioxidants. Antioxidants basically are very important preventing cancer, heart disease, inflammation, infection. Antioxidants, if you want to picture something, they're what sort of surrounds and protects your cell from things in the environment that come in and potentially destroy your cells and damage you. So that's not any different. Gum disease is a chronic infectious disease. We know that. So we know that if we can help nutritionally support the body, it's going to support the gums as well. In addition to that, you know, there are doctors out there, dentists I should say, that do blood testing, genetic testing. There's a lot of risk factors involved in gum disease, and cavities aren't as big a problem for most of us that go to the dentist routinely, but gum disease affects anywhere from 70 to 80% of all people in this country.
Wow.
And that's why adults typically lose their teeth from lack of bone and healthy gum around their teeth. And so this is what we really try to focus on a lot in our practice.
Okay, Stan, gum disease. How do you get it? When does it start? How do you know if you have it? What in other words?
Well, gum disease, as I said, can start at any time. Most of us, especially if you remember the commercials, Listerine, gingivitis is usually the start of gum disease.